Good afternoon, everyone. Thank you so much for being here. My name is Sydney Carter. I'm the Policy Program and Special Projects Manager at the Network of Behavioral Health Providers, and I'm excited to present our September CEU training today, Cultural Considerations for Addressing Mental Health in Latinos with Diane Arms at the Council on Recovery. And I will go ahead and place the CEU eligibility information in the chat. But if you would not mind turning on your cameras if you feel so inclined and muting your microphones. And if you have a question, please place it in the chat and I will ask Diane at the end, or I'm sure she will also queue for questions during the presentation if time allows her. And so for the CEUs, we have 1 hour of CEU credit available to LMFTs, LPCs, LCDCs, peer support specialists, and licensed social workers. And to be eligible for that, you must have joined the presentation by 2:45 and stay for the duration of the presentation, as well as take the 2 surveys that will be placed in the chat. So there's one NBHP one for CEUs, and then there's one that Diane is going to offer in the chat as well, both at the end. And so without further ado, I will pass it off to Diane and feel free to introduce yourselves in the chat in the meantime. Thank you.
Thank you, Sydney. I am so excited to be here. Happy Hispanic Heritage Month to y'all. I am so grateful to NBHP for acknowledging that this is an incredibly important month, not just for the Latino people, but for the community itself. So I am talking about cultural considerations for addressing mental health in Latinos, as Sydney stated. I am the Director of Community Behavior Health here at the Council on Recovery, but I also serve as a consultant and advisory board member for the National Hispanic Latino Mental Health Technology Transfer Center, longest name ever. It'll be changing soon because they just became a center of excellence, which is very exciting. They are out of Puerto Rico, but are able to provide presentation and technical assistance to many different programs and organizations across the United States because of their Center of Excellence and NHL MHTTC status. So MHTTC uses affirming, respectful, and recovery-oriented language. I am going to ask, as you guys are introducing yourselves in the chats, you just put what your role is at your organization. A lot of times this actually helps me kind of pivot if I need to. And so let's see, let's take a look. What do we have here? JPD, Specialty Court Parent Partner, nice. Social work, case manager, executive director, special education, social worker, LPC. Wonderful, I love it. Thank you guys. So this is going to be a relatively engaging presentation. I will also say that this is normally given for 2.5 to 3 hours. So I did condense a lot of information, but I'd be glad to answer any questions that you may have. I can connect with you in LinkedIn at the end of the meeting or via email. So let's talk about our learning objectives. We're going to identify trends in mental health disorders, including suicidal thoughts and behaviors. We're also going to discuss culture-specific risk and protective factors associated with mental health. And then we'll discuss cultural elements that inform mental health assessment and treatment for Latino and Hispanics. And then why is there a Starbucks cup, you ask? Well, because at the end, if you have attended any of my presentations before, you know that I like to keep things competitive. So at the end, we'll have 2 cahoots and both first place winners will receive a Starbucks gift card. So that's how I get people to pay attention. Because I mean, who doesn't love Starbucks? So a little bit about me. This is my grandma and grandpa. They immigrated from Monterrey, Mexico. They were teenagers and they had an education, a 3rd grade education when they came over. And this is my big Latino family, and half of us are probably missing in this photo. But I like to start with these photos because it's a personal side of me that I like to give to the people that I'm presenting to understand why this topic is so important for me. So my grandma, as you see her kind of in the middle here, she had undiagnosed anxiety for as long as I can remember. And it wasn't until her dementia sat in that they were able to identify that her anxiety was also out of control. It's incredibly important that we talk about these things. And one of the driving factors in why I actually got into the mental health field. So let's talk about some statistics. 36% of Latinos with depression received care versus 60% of whites. So this is according to SAMHSA, and a percent of population with feelings of sadness, hopelessness, worthlessness, or that everything is an effort of 18 years of age. And this was in 2017. So if you look at these, the graphs, you see that the Hispanic population was feeling higher levels of that. 50% of Latinos return for a second visit with a mental health provider versus 70% of non-Latino whites do. So what about Latino children and adolescents? Drug use is actually higher among Hispanic teens. They're more likely than Black and white students to engage in risky health behaviors. So if you see on the left-hand side, it is that they used the following drugs at a higher rate than their white counterparts, cocaine being the highest, but ecstasy and methamphetamine coming in close second and third. We see that also Latino adolescents are more likely to initiate alcohol use or cigarette use in the past year, and they're half as likely to use stimulants to treat disorders such as ADHD and ADD. We'll talk a little bit about the role that medication plays in the Latino family when it comes to mental health later, but that's just a little teaser so you can see that, you know, although we are more likely to initiate this drug use, maybe for coping, we are less likely to use prescription drugs to treat some of these mental health disorders. So what does it look like? Research on Latinos and experiences with mental illness. Latinos experience depression in the form of body pain, such as backaches, headaches, stomach aches. They describe their symptoms of depression as feeling tired, having changes in their sleeping patterns, feeling nervous. But they're also more likely to believe that their symptoms are caused by outside environmental causes or spiritual or personal issues. Like a spiritual causality is why they're experiencing the mental illness. They're less likely to endorse a biological etiology of depression. And like I said, they view medication as addictive and harmful, so they prefer counseling over medications. And we'll talk also about what that counseling looks like, and being aware of the different types of counseling processes that may interest a Latino client that in tandem with the original or regular counseling, normal counseling that we often talk about. So that spiritual causality is something that's really important, and they often talk about, like, why is God punishing me? And one of the risk factors that we will talk about, and it could be a risk factor or a protective factor, is fatalismo. It's that fatalism that the Latino community often relies on. So the Latino mental health crisis is real. 1 in 8 people in the US identifies as Hispanic or Latino, and by 2050, an estimated 25% of our population will be of Hispanic descent. Who has read the Texas Tribune article with Texas being at 50, I believe it's 51% now, with Latinos being the majority minority? It's incredibly important to know this because these are the people that we are treating. These are the individuals that are in our community. Now, you also have to understand that there is never going to be a one-to-one mental health Latino professional to Latino client or patient. So what do? We have to have presentations like this so that people are more well aware of the cultural nuances of the community so that they're better equipped to treat them. So 12% of Latino children with mental illness receive the psychological care they need. And a terrible statistic, 5% of mental health professionals identify themselves as part of an ethnic or cultural minority, but less than 2% are able to work in a language other than English. Can we talk about disparities? And then if you see on the right side, I won't read those to you, but it appears that 20 Latino mental health professionals per 100,000 Latinos. So that is a staggering statistic, and one that we can't fix by having every Latino go into the mental health field. Some more statistics. These are some common mental health disorders: depressive, GAD, general anxiety disorder, PTSD, and also substance use disorders. If you look on the right-hand side, you'll see that the prevalence of mental health disorders is less for Hispanic parents than non-Hispanic parents. It shows the similar susceptibility to these issues, but as the previous slide stated, the reason isn't the susceptibility. The reason is access, right? Without treatment, these mental health conditions can worsen and become disabling. So we have to talk honestly and frankly about the disparities that Latinos experience in searching for mental health or substance use services. So what does depression look like? I mean, you guys can look at the DSM, but it's pretty similar. Unusual sadness or irritability, loss of interest, some changes in weight, sleeping patterns, worthlessness, not a lot of self-confidence, thoughts of or attempts at suicide. But I want to highlight the statistic at the bottom, where first and second generation Hispanics are significantly more likely to have symptoms of depression than those born outside of the US mainland. Why do you think that is? Anybody can raise their hand or come off the chat. Or come off mute, sorry. No?
There's some chat response.
Okay, what do we have?
Maria de Jesus said, Campos, sorry, added stressors, cultural clashes, and expectations.
Cultural clashes, and expectations. Things are completely different from someone's home country and then when they arrive into the US. We'll talk about acculturation, but yes, Maria, that you're exactly on point. What does anxiety look like? It looks like trouble sleeping, very psychosomatic, stomach aches, other physical problems, avoidance of situations, trouble focusing, disruptive behavior, or overly self-conscious behavior. And these two lead to higher rates of suicide. 1 in 10 Latinas attempted suicide in the past year. 2 out of 10 had made a plan. And it is the second leading cause for Latinos ages 15 to 34. This graph highlights that information. What does suicide look like? Making suicide threats, negative views of self, sense of hopelessness, isolation. So this isn't anything new, but we have to equip our parents and our families with understanding these suicide warning signs as well. I think in the chat, somebody had said that they are a parent partner. These are the things that we need to talk about as we're helping our parents who may be first generation understand the signs and symptoms of suicide. I remember, I mean, and it just didn't happen in my family. It happened in other families I know as well, where, you know, I'd tell my mom, Mom, estoy triste, like I'm sad. And she'd be like, go do a chore or go do this, or you don't have time to be sad. You don't have time to, you know, that's for other people. You don't have time to be sad, right? But who knows what that would have led to if I hadn't had other individuals help me work through depression and anxiety. It was very important for me to have those individuals that knew what those warning signs were. What do the trends look like for Latinos by age group? So with females and males, 15 to 24, the main way of suicide is suffocation. Suffocation followed by firearms. So with suffocation, what does that tell us? Come off chat or come off mute or put it in the chat. I know that. It tells us that they have the means, right? Unfortunately, you really don't need much for suffocation. So this is why it is so incredibly, it's an incredibly important time for us to help these young Latinos, these young individuals. I mean, after COVID, suicide became rampant. So I want everybody to take out their phone and put 988. It was a lot more impactful when I made everybody take out their phone and do the 1-800-273-TALK. Because now 988, thankfully and gratefully, is a shorter number that we can remember to help either ourselves, our family, or our clients when they are in crisis or contemplating suicide. I would be remiss if I didn't put a plug for ASSIST, which is Applied Suicide Intervention Skills Training. We at the council have 2 trainers and would love to come out to your organization. If it's a 2-day training all day, but it is an amazing, amazing training to help individuals outside of people that are just involved in mental health. We've trained our financial staff here, our development staff, our welcome center staff. It truly is a training to help the layperson intervene when somebody has thoughts of suicide. So let's talk a little bit about culture bound syndromes. What does the term cultural bound syndrome mean? Well, it involves groups of symptoms that only co-occur among individuals in specific cultural groups or communities, ethnicities, and in contexts. There's some diverse attributions of these symptoms. So I'm going to go through a couple of them. Most common, ataque de nervios. Can anybody share what they think or what they've seen this as?
Anxiety.
Panic attack.
Mm-hmm. Yeah. So ataque is associated with disruption, an attack, right? It may be used to indicate a lack of control, which is often with anxiety in response to a trigger. So what this most likely aligns with in the DSM is like panic attack or panic disorder, dissociative disorder. There's intense emotional being upset. Could be some crying, some trembling or shaking, some verbal or physical aggression. And it could occur as specifically a specific event, exposure to an event. What about, we talked about nervios, so we're going to talk a little bit about nervios in children. What does that look like? So brain aches, irritability, stomach disturbances, again, all like very much somatic responses to this anxiety. Easy tearfulness, some trembling, dizziness. What about susto? It's attributed to a
What
fright.
does susto mean?
Go ahead. What does susto mean? Susto means, susto is like scared. Like, me asustaste, you scared me. But these can be, this specific cultural bound syndrome can be characterized by feelings of loss and abandonment, poor self-image, suicidal ideation. It could
Weather for the next 10 days.
It could be specifically contributed to a specific frightening event. So it may look like post-traumatic stress disorder. Again, this also may occur with somatic symptoms. There is a place in the Andean region that also calls this espanto. So it depends where your Latino community is coming from, that you could hear susto or espanto. Another DSM diagnosis that it could look like is maybe stressor-related disorder or somatic symptom disorders. What about mal de ojo? Has anybody heard of mal de ojo? It's considered an illness transmitted by making eye contact with someone as it is received through the eyes of the intended recipient. The instigator covets the victim child or covets something of the victim. And when the illness is passed, it heats the blood, causing multiple gastrointestinal problems. So you'll often see little babies wearing little red bracelets with an eye, like an eye-looking bead on it to run those mal de ojos away. And it is because it is thought that if somebody covets the child or covets something in the family, the child could get sick and it would cause a lot of gastrointestinal issues. So those are just some of the cultural bound syndromes that we often see in our Latino community. So here's some risk factors and protective factors. And we'll talk a little bit about more these in depth. With protective factors, we can see that they're associated with a lower likelihood of negative outcomes. With risk factors, we can see that they may be unfortunately linked to worse outcomes. I do want to state this caveat, though, that in some families, risk factors can actually be a protective factor, or a protective factor can actually be a risk factor. If there's anything that you get out of this this training, is that the Latino community encompasses many different facets. People from different countries, from different parts of the world, from with different dialects, with different customs and traditions. They also come with, it's such a complex community. You know, I always like to tell the story of my partner who's Bolivian and me who's Mexican. We were talking about something about a person being bald. And so I said, oh, pelón. And he said, why are you using that word to describe him if he doesn't have any hair? And I was like, well, pelón means that in my language. And he's like, pelón means hairy in my language. So even being in, you know, we're both, he's first generation, I'm second generation. We lived in Houston, but we have very different terms of one word. And the list goes on, right? So what are some common risk factors in the Latino population? What we're going to do is we're going to use the social ecological model because that considers the complex interplay between the individual relationship, community, and society. It shows how one factor can impact the next factor. So let's start with at the individual level, language barriers, low education or financial status. Between 2014 and 2019, the proportion of facilities in the US offering mental health treatment in Spanish declined by 17.8%, a loss of 1,163 Spanish-speaking mental health facilities. And between 2014 and 2019, the US gained more than 5 million Hispanic residents, but lost more than 1,000 facilities with clinical staff providing these in Spanish. That in itself can be a barrier for somebody to receive services. So even though, we have translation lines aren't always the most comfortable or aren't always the most empathetic. Spanish can be learned by different people, and I encourage people even outside of the Latino community to learn Spanish because it's such a rich going to be heard in the language that they're most comfortable in. So we talk about relationship. Maria, you said it perfectly, acculturation, right? So if we transition into a new culture and we look at the community that's transitioning, this requires either transitioning out of the old culture to balance the new culture, or staying in the old culture with having a new culture around it. Either of those scenarios leads to confusion, right? So we also have to be respectful of the amount of time that somebody's been here and their familiarity with the new culture. It takes time and it takes energy, and there's a reason why research shows that the further down the generation, immigrated generation is, the more likely they are to be acculturated to the American way. So I wanted to show this graph because it shows that during COVID, Hispanic and Black households with children experienced 3 or more hardships. So if you look at 3 or 4 hardships on the right-hand side and 5+ hardships, they were twice the rate of Asian and white child households. That's huge. So we do talk about different social determinants of health, right? Stereotyped gender roles, disparities in services, and other social determinants of health. So Latinos are less likely to have health insurance. Well, that can lead to a lack of access, right? So what are other social determinants of health that may be a risk factor for the Latino community? Maybe lack of transportation, lack of childcare, or living in a food desert. All these can add to the risk of somebody developing a mental health diagnosis. So I want to go a little into depth about the stereotyped gender roles here. Machismo and Marianismo. Machismo is the expectation that men will take the role of the protector or provider for the family, demonstrating strength, self-reliance, and control. Marianismo is the expectation that females will take on a Virgin Mary-like demeanor or the role of the caretaker for the family, demonstrating purity, care, family privacy, and morality. So how can these be seen as risk factors? Or let's start with protective factors. How can these two be seen as protective factors? For one, a man has a purpose, right? Could be protectful. It could be like, I'm here, I know what I need to do, I have a purpose, etc. Marianismo, same thing. I have a role, I have a purpose, but how can these also be risk factors?
For machismo, a man might not feel like he could be vulnerable or
Yes.
accepted or ask for help.
Oh, thank you, Gabriela. Yes, that's perfect. Marianismo? What about Marianismo being a risk factor?
I would say the same thing, just the need to take care of everyone around them.
Yeah, those are some pretty big shoes to fill of the Virgin Mary, right? Like,
Yes.
Right.
oh,
And also
So-
you're taking care of everybody and so you're not paying much attention to yourself because you're taking care of everybody else.
Exactly. Yeah.
so these are great examples of what can be seen as a protective factor and a risk factor. It just depends where somebody lies on their like what generation they are that have immigrated, if they've immigrated, what country they've come from, etc. I originally had these as protective factors, but have since then made it very specific that they can be seen as risk factors as well. So for the last ring, societal, we talked about social determinants of health, but also like marginalization, policies that are written by white, cisgendered, older men, right? And that's supposed to say institutions, not intuitions, institutions that have been set up by people who don't have the same thoughts as us and don't have the same experiences. These circumstances are shaped by distribution of money, by power, by resources, and can all impact somebody's mental health, needless to say, right? So when we talk about racism, we talk about oppression. If my grandma was receiving care at a facility and they only spoke English and forced her to use the language that she was so uncomfortable with, might she feel oppressed? Anti-immigration laws, even the rhetoric of it. I will say I worked for a Latino association and a couple years back, and there was an administration that had a lot of language around DACA. And we provided HIV education and training and testing. Well, we did see decreases in HIV testing because people were afraid that if they were going to be using a government resource to get tested for HIV, they may be banned. And that was just around the conversation of DACA, talking about education. So racism can lead to ethno-racial trauma, not just in the immigrant Latino, but also Latino communities. And it is so important that we acknowledge and that we attempt to address. These things did not happen overnight. So I know it's going to continue to take time, but I'm again incredibly grateful for NBHP in highlighting the necessary training that needs to happen when it comes to like different cultures, etc. So protective factors, increasing of protective factors in the community will reduce mental health conditions and substance use disorders. So protective factors reduce negative outcomes, and there's two types of protective factors: variable, so that can be income level, peer group, adverse childhood experiences, and employment status. But there's also some that don't change, include the genetic predisposition, right? I'm often told, you don't look like a Latina, which is super rude because Latinos can come in every color, shape, size, all the things, but I don't look like my brother or sister, right? And they're just as much Latino as well. Their genetic predisposition doesn't change, neither does mine. And that will never change. So they may be at a higher level colorism is a real thing, and they may be at a higher level of racism or of oppression because of the color of their skin. So what are common protective factors in the Latino population? We'll start with fatalismo. So religion and spirituality. It's a connection. It's really about a connection with the community, with other Hispanics and Latinos. And this really may inspire hope to the client or patients. So what clinicians really need to know about this is that they need to respect traditional healing approaches. What does that look like? That may look like a curandero. That may look like a priest. But that fatalism is the value of destiny, or in some cases, divine intervention. So somebody may think like, okay, you know what? I'm not gonna seek chemotherapy. I'm gonna pray about it, and I'm gonna let in los manos de Dios, right? Like we're gonna put it in God's hands. And we have to respect that, right? Everybody has their own position on religion and spirituality. Yeah, that's all I'll say about this. Familiarismo. So what does that mean? Involve the family. Have clear roles and expectations of the family. How many of you all have had a Latino come to your office and there's like a tío, a tía, cousin, and uncle, and aunt, you know, a grandma. If we live in multi-generation homes, there's more likely a chance that these other members of the family are going to accompany someone to an important appointment, because our family's opinion really matters. That being said, this can also serve as a risk factor, because there could be some cognitive dissonance between a person who, for example, really wants to be part of their family, but is part of the LGBT community and their family has shunned them, right? So that in itself can cause friction, can cause familiarismo to not just to not be a protective factor at all. And additionally, there's times where families tend to get over involved, and then you have like 6 people making the decision when it really is the decision of one person. So the role of the family may have a negative stigma. They do often turn to community-based care before assessing a formal network. Also, family members may share medication with other family members while integrating alternative medicine. But ultimately, the cultural value of familiarismo puts the family's well-being at the forefront of the case, of the forefront of the care. I will say that familiarismo is really important when it comes to like marketing, because people trust their community. The Latino community trusts people who have gone on the same journey as they have. So there is no better marketer than a satisfied client or patient in the Latino community, because they will scream it at rooftops and they will give your number out like candy. So another mental health protective factor, respeto. Respect is obviously important in all cultures, but it is one that is highly valued in the Latino community. They tend to expect status differences between professionals and non-professionals. I know, at the end of my grandma's life, before her dementia kicked in really bad, whatever her doctor would say was like Bible. She was so like, no, me dijo el doctor, like, that's what I'm going to do. That's what the doctor told me, because they understand that there's a status difference between a professional and non-professional. There's a high value on respeto, and one is respecting the person of a higher status. Warm and personal interest can increase engagement in the therapeutic process. How can this be seen as a risk factor? Well, for one, if they highly value the position of a professional, there may not be as much self-determination for them to receive or to go through with the treatment that is being recommended. So personalismo, get personal. I think you can raise your hands. By show of hands, how many people have had a Latino client or patient give them a gift, invite them to a birthday or a wedding or a quinceañera, right? Like brought tamales, brought bizcochos, brought like whatever it was. This is because personalismo is something that they like. They want you to be part of their family. They want you to be on a personal level. They respect you. So they want to invite you into their circle, right? So if a healthcare provides or demonstrates simpatia, which is kindness, and are friendly, the likelihood of compliance with treatment and recommendations will increase. I used to live in El Paso, where my parents are still at, and it was predominantly Latino community. I ran a children's behavioral health clinic, and we had one psychiatrist, and we probably saw, I don't know, like 10,000 kids. But so we had to hire another psychiatrist, but they were scarce in El Paso, especially one that spoke Spanish. So we actually had to contract. We contracted with an organization in Dallas, and the doctor that ended up coming on was Dr. Simmons, a Black man in his late 30s. But when I tell you that he made such a difference on our families, that people were starting to choose him, like the telehealth over the actual provider, because he was able to show empathy, and he was able to show like that he didn't culturally know everything about the Latino community, but he was willing to try and he was willing to be there. So it's important to know, like I said earlier, we're not going to get the one-to-one Latinos. We need allies as Latinos to be those mental health providers that are cognizant and can realize that empathy can get you a long way with us. So I put that bug in your ear because I think a lot of times people say, oh, well, they don't look like me. They don't talk like me. Yes, or yes, but they're still trying. And that effort goes a long way. So collectivism, the emphasis on group activity rather than individual task. It's a responsibility for achievement that is a shared concept, and it's a sense of balance or harmony within collectivism and interdependence. Again, this can also be seen as risk factors because it's for the greater good rather than for the individual. Okay. With all that being said, the cultural identity of the individual is so important to acknowledge. Do they speak Spanish? What is their ideal of personalismo? What is their engagement? What do they think about familismo, machismo, marianismo? All of these have to be considered when you're working with a Latino client. So there are some assessments, one specifically being the DSM-5 cultural formulation interview. It is a set of 16 questions or emphasizes 4 domains: cultural definition of the problem, cultural perception of the cause, context, and support, cultural factors affecting self-coping and past help seeking, and cultural factors affecting current health. So there is also a CFI informant version, and it's provided within the DSM-5. This interview follows the same format, but again, Hispanic and Latino individuals frequently desire to bring family members into the assessment process. So this may be beneficial to obtain a more complete clinical picture. There is a school-age children and adolescent supplementary module of the CFI. And in general, culture-centered treatment is used to encourage the use of a cultural lens as a central focus of professional behavior. In culture-centered practices, all individuals, including the treatment provider, are influenced by different contexts, including the historical, ecological, socio-political, and disciplinary systems. What you should think about when you're providing interventions. Think about the client's concept of health. Do they believe that it's biological in nature, or do they think it's something divine, something that they were destined to deal with? Understand their concept of distress and suffering. Definitely talk to them about their values. And there is a framework that was developed specifically for this purpose. It's called the ecological validity model. It was created in order to provide a holistic framework to provide treatment by Bernal. And it shows that these culturally adapted interventions have lower rates of premature dropout. So these are the 8 areas in which you can adapt treatment to be more effective with ethnically diverse clients and students. And I'm not going to go in through all of these, which is something I usually do in the longer presentation. But there is one that I really like to highlight on, and it's talking about context. High context versus low context. So Latinos are a high context culture. They don't just take the word for face value. So, and you know, interestingly enough, I've had to work with my boss on this because she'll say the sky is blue, and I'll say, is she telling me the sky is blue because she wants me to wear blue tomorrow? You know, not to that extreme, but it's something similar. Like, I take everything in context. What was her tone? Did she use her hands? Where were we when she told me this? Context is incredibly important when you're working with ethnically diverse Latinos. So I am going to now go to Kahoot number 1 because we have 12 minutes. So I am going to do a new share. And where is this? Here we go. Share. Oh, no, stop share. Let me share my Kahoot 1. Share sound. Considerations 2. Okay. Do you see where it says, let's see. Are we good? We're gonna do 1 minute. All right. How many do we have here? All right, I'm gonna get started. We have 35 people, unless somebody jumps up and says no. Don't start yet. Okay, 5, 4, 3, 2, 1. All right. And if you didn't get this round, there is a second Kahoot. So let's start this one. Cultural considerations quiz 1. Percent of Latinos that return to the second mental health visit. 5 seconds. And there's 4 questions in each of these tests. It is 50%, 50%. Although we would love for it to be 80, we're glad that it's not 30 or 24. All right.
Diane, I think, I'm not sure if it's just me, but your screen is showing quiz 2. And so I didn't see the first one. I'm not sure if that's just me.
Oh my gosh.
And mine was showing like shapes.
Yep,
Okay.
same here.
Same, I'm in.
Yeah,
in
mine
one
was
of
showing
those.
shapes also.
Oh my goodness.
Mine
Okay.
too.
It
Yeah,
didn't
so is
work.
mine.
It didn't work for me either.
I don't know.
We're gonna start again.
Yeah, we should all see the shapes. But we'll see the shapes on our screen, but her screen will show the question.
Yes, so my apologies. I am terrible at technology.
No rush. And I put the link in the chat if everyone wants to click it. If anyone didn't get in last time, I'll
But
just put
this
it.
will be a different link because this is cultural one.
Oh,
cultural
never mind.
one.
Delete
So
that.
don't click that.
Delete.
Now it's asking for the pin.
Okay, hold on. I'm getting it up. Share screen. Loading Kahoot. Okay, it should say loading on your screens.
It
Yes.
says loading now.
There we go.
I need the pin. I need the pin.
Yeah, mine is asking for the pin again.
Pin. I need the game pin.
I need the
pin-
link.
There we go. Cultural considerations quiz 1. If you see that at the top, right? Everybody should say quiz 1.
Yeah.
No, it's
I
asking
need
for
the
a game
game
pin.
pin.
Yeah, it's asking for the pin again.
And it's loading game pin.
Okay, the pin is live now.
Yes, 673-6272. Sorry about the technology issues, y'all.
Okay.
And this allows up to 100 people, so we shouldn't have an issue with space. All right, I'm gonna start it in 5 seconds. So this should be, okay, so we're all on the same page. Cultural considerations quiz 1, am I right, Sydney?
Mine says get
Yes.
ready. Question 1. Okay, so that looks like now the question is percentage of Latinos who return to the second mental health visit. And then
Yes.
whatever the question is on the shapes is what shape we click.
Yes, and that should be a given because I just gave it to everybody. So I want to see, yes, it is 50%. 50%. Thank you. Let's see
I didn't.
who's at the top. All right. Next question. So let's see. Ooh, Virginia, you are in the lead. With Evelyn following right behind you. Percent of mental health professionals that identify as ethnic cultural minority. The answer is 5%. Okay. Did Virginia stay in the lead? Nope. Evelyn, you took the lead. Who's next? Suicide is the 7th leading cause of death in Latinos 15 to 35. True or false? It is false. Unfortunately, it is the 2nd leading cause of death. So Alba, you have taken the lead. And I believe this is the last question. Latino cultural bound syndromes. All of the above, yes. All right, who is on the podium? 3 is Angel or Angel. 2 is Virginia. Oh, Virginia, you were so close. And Alba. Alba, if you can share your email with Sydney, I will send you your Starbucks gift card. So now we will go to cultural considerations part 2, which is the second half of the presentation. And I am sharing my screen now. And this is a different pin. So again, 4 questions. The pin should be 8340047. All right, 5. All right, here's this one. Should say cultural considerations quiz 2. Socio-ecological model includes all of the following except financial. Yes, the majority of you got it right. Let's see who's at top. Maria. Ooh, followed by Angel. Is Angel gonna win too? All right, next quiz. Collectivism can be a protective factor. True or false? Well, yes, no, yes, and no, or I just came for the goodies. Yes and no. So about half of you all, I tricked you. Oh, Maria is still in first. 3rd question. Latinos are generally a high context culture. True. Yes, most of you got it right. All right. Last one. DSM CFI stands for. I'm not going to read them all. Yes, the DSM cultural formulation interview. And I just realized I have that spelled wrong. So number 3, Maria. Good job. Second, Gladys. And first is Angel. Okay, Angel, please send your email. And I have one more thing for you all. If you could please take this survey. Thank you to, where am I here? NHLMHTTC and the Council on Recovery. Here's my LinkedIn if you want to connect. If not, just find me by Diane Arms. And then if you can please take this survey, it helps the NHLMHTTC continue funding technical assistance and initiatives like this. And with that, Sydney, I am done.
Yes, thank you so much. And I also put in some information in the chat about NBHP's CEU if you're seeking CEUs. So there's 2 surveys this time. So please do the QR code on the screen for Diane's survey. And then to get CEUs, please make sure you take the survey that I just put in the chat, the link, by 12 o'clock p.m. tomorrow. And I also put some other information. We have 1 hour of CEUs available to LMFTs, LPCs, LCDCs, peer support specialists, and licensed social workers. You must have joined by 2:45 and stayed for the duration to be eligible, as well as take the survey by 12 p.m. tomorrow. And the CEU will be in your email by the end of this week. We'll also have the recording and the recording of this on our website and our YouTube channel today. And I will just look at a few. If anyone has to go, thank you so much. I appreciate you
If
being
there's anybody
here.
who needs to stay, who wants to stay on for chat, or questions.
Yes. And thank you so much, Diane. There's so much praise in the chat. I'm going to just look through and see. I know there were a couple questions that popped up, so I'm just going to look through real quick.
Okay. There is a question if they can send this survey. Yes, we can send this survey that is for NHLMHTTC.
Yes. I can put it in. Let me get it on my phone and then I can put it in the thank you email. All right. So let's see.
And you have 2 emails for me.
Yes. Yeah, I have I got, let's see, Alba's, and then I just need
Anken or Angel.
okay, cool. So if you wouldn't mind having that, lots of people were responding to your questions in the chat throughout the presentation. So there was that. And then let's see, lots of comments and
Yeah. Oh, yes. So good.
and one question, I think it was kind of about the idea that Virgin Mary women, someone was asking Francis, do they believe unmarried to remain virgins until marriage?
Yeah, I mean,
That's part of it.
this is still heavily considered value and goes along with that Marianismo. Also, again, depends on where you're at in the generational, coming to the US. And whether that specific community follows culture, Catholic, because just not all Latinos are Catholic, right? And so most the Latinos that are Catholic will follow the being a virgin till you're married, but it's more so because of the religion focus. But other questions, I am willing to answer any questions you all have or any comments.
Let's see. Also just people saying they've learned so much. They've attended lots of other presentations that are similar, but they've learned the most at this one, and this one tops them all. And everyone's saying they really liked the game. It was encouraging. And lots of thank yous.
From different, one from Asian Indian background, see so much in common with the Hispanic Latino community. Yes. Yep. Good. I'm glad. Again, like I said, it's like 2.5 to 3 hour training, but I'm glad that y'all stuck through it. I appreciate your time.